Also just having a great opportunity to have some of the sessions that we had hoped to have at our Child Welfare Evaluation Summit that we turned into a virtual summit series, but there were some of those sessions going on at this conference as well. So just really enjoyed also running into people in the hallways. I see that happening all the time, people giving each other hugs, saying, oh, it's been so long. But I really appreciate that, and I hope you do reach out to all of us, especially the federal staff. We really love connecting with all of you and hearing from you, and definitely giving us feedback about these meetings. We're really thinking thoughtfully about how we should convene these meetings in the future. Thank you for doing that, and continue to make those connections. I just want to take a moment, if we could put up the slide that I had asked for. We talked about the Children's Bureau family yesterday, and us, really working so closely. And I wanted to just really recognize a member of our family who's no longer with us. Last month, our dear friend and colleague Pam Johnson passed away, and actually today would have been her 61st birthday. So we felt really strongly that we wanted to acknowledge her. I know many of you know her, who've worked with her. She's just really been what people who know her know she's a transformational leader. And in particular, she's really committed to the youth issues and foster youth issues. She was the National Program Officer for Independent Living Programs. She was responsible for really overseeing the Chafee foster care independence programs and all the technical assistance that went along with it. And before that, she worked on runaway and homeless youth programs. And I think she worked at the federal government for over 30 years. So a wonderful, wonderful woman. Learned a lot from her, and I was very fortunate that she was a mentor to many of us who are new. So I just want to pause and say, Pam, we miss you, we love you, we know you're in a better place. And I also just want to let you all take a moment. I know all of you and each of you have probably lost a loved one, a friend, a colleague in the past year that's really meant a lot to you. So I think when we're here doing this work, we're here because we've had wonderful support from people along the way. And I think it's really important that we recognize the people that aren't here, that are also sort of standing behind us, even in spirit, that we think about that. So thank you. So now it's with great pleasure that I get to introduce our Associate Commissioner, Ju Chang. She was recently appointed by President Obama as our Associate Commissioner, and she's been saying, I didn't realize this, I forgot, it's been 7 months since she's been appointed. It feels longer, but in a good way, in a really good way. She basically administers, over $7 billion in federal programming around child abuse prevention, protection, foster care, guardianship, and adoption programs, and she's been a longtime advocate for children and families. Folks may have known her when she's previously served as Senior Director for Public Policy at Casey Family Programs, as well as Senior Staff Attorney for the Children's Defense Fund. She's definitely been committed to children's policy issues for a long time. And I will just add that personally, it's been wonderful. What I've really appreciated most about it is that since we've gotten to know her, is just that, we've gotten to know her. Ju is a leader who really wants to know what's happening in programs. She takes the time to talk with staff to really understand what's happening. She's committed to staying here for the whole conference, which is really kind of unheard of for some of our political leadership. So we really, really appreciate that. And I think the other thing is I remember when she said, I'm coming, tell me what you'd like me to do, tell me where you want me to be. So she may have regretted that, but we plugged her into a number of things and 2 policy forums. I think, in the 12 years that I've been with OCAN, we've never had a political appointee, honestly, Ju, that's taken the time to participate in the sessions in that manner. So I really encourage you, if you see her, stop and say hello and bend her ear. But anyway, please join me in welcoming Ju Chang.
Thank you, Melissa. Good morning, everyone. I'm very pleased to be here with you for the 19th National Conference on Child Abuse and Neglect. It's wonderful to be here with so many dear friends, mentors, teachers, and colleagues. I want to also send a special greeting to all of our friends who are participating via live webcast. Melissa said yesterday that this was like a family reunion. And as one of the newer members of the CB family, I want to thank you for your warm welcome to this conference and to the larger CB community. I had the pleasure of meeting with many of our grantees earlier this week and to visit yesterday with a local program that's doing innovative work with mental health providers and the courts to serve infants and toddlers who've been abused and neglected. And I want to say that living in Washington, D.C., where you are surrounded by policymakers and the politicians for whom they work, it's easy to forget about what's happening in the real world. So I just want to emphasize how helpful it is to hear directly from those of you on the ground and to see what great child welfare practice in action really looks like. And to quote Angelo, who said yesterday that it's wonderful to be surrounded by fellow believers. So to Melissa's point, please come and talk to me, share with me what you're doing in the field. I really am eager to learn. And so I also wanted to acknowledge that for those of us who work on child welfare day in and day out, it's good to be among our friends and allies and to know that we aren't alone in our efforts. So I join with my colleagues in encouraging you to make connections with new allies who can strengthen your work and encourage you during those tough moments. I also want to take this time to personally thank all the members of the local host committee, as well as, I believe Melissa told me that there are up to 200 volunteers from this area who are working on this conference. I want to thank you for welcoming us to your beautiful and charming city of New Orleans and for all of your support for this conference. Judging by the participation this morning, I think it's safe to assume that people are having a really good time here in New Orleans. I'd also like to thank Catherine Nolan and Melissa Radowski, as well as the entire OCAN team, for their extraordinary work all year long, but particularly for all of their efforts to make this conference possible. Yesterday, you heard from Mark Greenberg, who is our Acting Assistant Secretary at ACF, that this administration views 2014 as the year of action. So I want to spend a few minutes highlighting 3 action steps that the Children's Bureau will be focused on in this upcoming year. The first is launching round 3 of the Child and Family Services reviews. The second is transforming our training and TA for public child welfare agencies and grantees. And the third is addressing the overuse of psychotropic medication for children in foster care. So the Children's Bureau is starting its next round of monitoring of state child welfare programs, also known as the Child and Family Services Review process. As you may know, we conduct these reviews in partnership with the State Child Welfare Agency to assess the state on a number of outcomes and systemic factors related to child safety, permanency, and well-being. The goal of the CFSRs is threefold. One, to determine what happens to children and families who are engaged in child welfare services, to ensure conformity with federal child welfare requirements, and finally, to assist states in enhancing their capacity to help children and families achieve positive outcomes. I want to start, though, by saying the philosophical underpinning of the CFSR. I know it can be a daunting process for states to go through. We talk a lot in child protection about the need to approach families from a strengths-based model, and we must do the same for one another in the field, right? So we believe and want to move forward from this belief that most state agencies want to do what's best for children and families, but sometimes may lack the information or resources to do so. So for this next round of monitoring, the Children's Bureau is making changes in the process to be responsive to what we heard from you in the field. We wanted to remove elements in the process that didn't provide us with an accurate picture of what's happening to children and families, and also remove elements that were overly burdensome to the state, while at the same time encouraging states to see the CFSR as part of their overall continuous quality improvement process. We've been working with stakeholders on these process changes via conference calls and regional meetings, and I want to encourage each of you to connect with your local child welfare agency partners to learn more about what their plans are for this next round of reviews. Once we get the reviews fully launched, we look forward to keeping the field informed about the progress states have made in their programs, as well as their continuing efforts to improve outcomes and their systems for children and families. We also recently announced that the Bureau will fundamentally restructure how we provide technical assistance to states, local jurisdictions, and tribes. These changes are based on our assessment of our existing training and technical assistance network. This included listening to our stakeholders and reviewing feedback from child welfare systems and TA providers. We also reviewed the literature, talked to child welfare agency managers, professional associations, federal staff, and service providers. So for those of you who may not be familiar, under the existing training and technical network, the National Resource Centers and Implementation Centers were funded to support states, tribes, and courts through a combination of product development and dissemination, training and peer networking events, tailored technical assistance in response to individual requests, as well as multi-year TA projects. With our transformation, services previously provided by National Resource Centers and Implementation Centers will now be incorporated into a new structure for the delivery of training and TA. It will be under the National Capacity Building Center for Public Child Welfare Agencies that will consolidate and centralize services and serve as a focal point for national child welfare expertise, as well as evidence-informed training and TA services for state and territorial public child welfare agencies, including those participating in Title IV waiver demonstration projects. In addition, the National Child Welfare Capacity Building Center for Tribes will serve as the focal point for coordinated and culturally competent training in TA to 4B and Title IV programs in American Indian and Alaska Native nations. In addition to transforming our TA structure for states and local child welfare agencies, I'm really pleased to announce that we will dramatically increase our investment in TA and capacity building for Indian child welfare. The National Center for Legal and Judicial Excellence in Child Welfare will serve as the primary TA provider of training and TA to state and tribal court improvement programs. So, from April of this year to March of next year, our capacity building services will undergo a transition period as current TA awards conclude, new federal opportunities are competed, and newly funded projects get underway. We are working to ensure that all of our TA and capacity building resources are coordinated and grounded in evidence-based and research-informed approaches to training, consultation, adult education, and distance learning. So, I shared how we have fundamentally changed or plan to fundamentally change how we do some of our daily business at CB. I want to close by talking about a really exciting new initiative by the administration that we want to put into action, the many lessons you have shared with us about how to serve our most vulnerable children. And those are children and youth in care with psychosocial needs that are not currently being met. In the President's 2015 budget, there is a new 5-year collaborative demonstration with ACF and CMS to encourage states to promote the use of evidence-based psychosocial interventions to children and youth in the foster care system, and at the same time to reduce the overuse of prescription medications, and ultimately to improve outcomes for these children. The need for action in this area is clear. According to the Government Accounting Office, up to 40% of children in foster care were taking one or more psychotropic medications. Children in foster care are prescribed these medications at higher rates than other children served by Medicaid, and often in amounts that exceed the FDA's guidelines. Deb Darrow said yesterday that the field often knows what to do, we just don't know how to do it. I agree and would add that sometimes we know what, we even know how, but we haven't asked our policymakers to invest in what we know works and how we know it works. So we've learned from systems of care and much of the work that many of you in this room have taught us that community and home-based supports for children with serious mental health needs is more than about money for treatment, right? That it requires investments in training and workforce development. We need workers to have smaller caseloads. We also need to recruit and train specialized resource families. Based on the existing evidence base in the area of trauma-informed psychosocial interventions, we know that we need a large initial investment to expand access to effective interventions. So this proposal says that ACF would invest $250 million over 5 years to build the infrastructure and capacity building, while the Medicaid investment of $500 million over 5 years would provide incentive payments to bring state Medicaid agencies to the table and work with child welfare agencies on this issue together. CB is committed to working with you as a partner in serving the most vulnerable children and families in our community. We have asked for your feedback on some of our most critical functions and have tried to incorporate them to make our monitoring, TA, grant programs, and policies reflect our shared vision while evolving to meet the unique needs and opportunities of this time. The partnerships we have with you are critical for our work moving forward. We know that the federal government cannot and should not do this work alone. So I hope you join us in this year of action as we move forward together to ensure the safety, permanency, and well-being of all children and families in this country. Thank you very much and enjoy the rest of the conference.
Thank you, Ju. And now, you know, these national conferences are always founded on a lot of traditions. So one of our traditions, if you've been to the past national conferences, is we have 2 awards related to child abuse prevention that we like to have as part of our plenary. So the first set of awards, I'm going to ask Lisa Byron-Berlin and her colleagues to come to the stage. And as they come to the stage, it's awards that are honoring incredible people doing work, parents and people working with parents around their work in child abuse prevention. And I will just have to say, Lisa has just been such a wonderful partner and advocate for all this work. So
thank you. Thank you very much. Good morning. Well, the room is filling up. People are waking up and enjoying. I just hope they turn the air conditioning down at one point. I'm the president and CEO of Parents Anonymous Worldwide. We are one of the oldest child abuse prevention organizations. We've just celebrated our 45th year, serving more than millions of parents and kids and youth worldwide. And I'm very happy to have some of my colleagues here today. And you are going to be introduced to Tanya Long, who's a program director and parent leadership coordinator in our Ohio office. But more importantly, she is the only living parent today who ever testified to pass CAPTA. In 2008, when Congress came to Parents Anonymous and said, why don't you testify? I said, why don't you have parents? They said, great, Lisa. And Tanya testified and helped to reauthorize CAPTA. As you... Come closer. I also want to introduce Kathleen Rowe, the Executive Director of Parents Anonymous of New Jersey, and she's celebrating her 30th year with Parents Anonymous and her dedication to strengthening families in New Jersey. We are very happy here to talk and to honor and to partner with the federal agency, as well as many colleagues in the room. I'd have to put on many glasses to see you all, and I hope you come up and say hello. We really believe that parents are the key to all that we're doing, and that if we reach out to families in a positive way and support families through evidence-based programs like ours and other programs that we partner with, that we have turned the tide in prevention at all levels. We established 2 awards, particularly because we want to honor the role of parent leaders. In Parents Anonymous, we do nothing without parents, whether it's developing a curriculum, whether it's launching the National Parent Helpline or the national certification of parent leaders and staff on shared leadership worldwide. Those were all developed and implemented with parents in significant leadership roles, making policy, implementing programs, overseeing evaluation in every aspect of what we do. And we feel that that is the best way to create better outcomes for families. It's not about doing it to people, it's working with them. We call our campaign Standing With Families. We are standing side by side with families to support them, not to take over families, not to lecture families, but to empower them. So our first award, and our awardees are not here, so Kathleen Rowe, please step up, because they are very busy leaders in the community, is Bob Stone, Robert Stone from New Jersey. He has received the 2014 Jolly K Award, the founding mother of Parents Anonymous, who I know Tom Birch talked about, who was the first parent to testify in Congress to pass CAPTA in 1974. And when Walter Mondale and Pat Schroeder came to a Parents Anonymous group, you have to realize there were not many prevention programs. They were totally in awe of what the parents were doing to change their lives and asked Jolly K to come testify. In the journal Social Policy, if you look back in 1975, staff, including Tom Birch and others, wrote an article about the most meaningful impact of that hearing, which was to hear from a real parent about their struggle and how they turned their life around. And she was an inspiration for millions of other parents. So Bob Stone is receiving the 2014 Jolly K Award for his extraordinary courage, commitment, and tenacity as a Parents Anonymous parent leader committed to strengthening families.
Thank you very much. Obviously, I'm not Bob Stone, but when Bob received this award, he was so excited and so thrilled, and I said to him, I will move heaven and earth to raise the money to get you to New Orleans, because as you all know, nobody funds you to fly to New Orleans. And he looked at me like I was crazy, and he said, Kath, who's going to take care of my 4 grandkids? You go. You get the award for me, and you give a shout out from the Men of Father Time, which is one of the most successful fatherhood groups in New Jersey, sponsored by Parents Anonymous, and tell them thank you so much. Bob Stone has the heart of a lion. He doesn't know I can't, I won't. 10 years ago when I first met him, Bob said, I was doing a focus group for why men didn't get involved with prevention programs. And Bob said, well, we want to be with other men. And we don't want people talking down to us. And we want to learn from each other. And we want to do things for the community. We want to be leaders. You know, New Jersey, come on. You know, you got the whole accent thing going here. We want to be leaders in the community. We want to give back. So these guys do fishing derbies, and they do father-daughter kings and princesses dances, and they march in the St. Patrick's Day parade. And they bring a pride to the Keansburg community, which was decimated, as you well know, by Hurricane Sandy. So Bob and his partner, Jeff Johnson, a social worker, to me they exemplify the Jolly K Award most, because it was a parent and a professional, a social worker and a parent, forming a partnership, and now their group is 40 men strong. So it just speaks to the importance of meaningful partnerships. And from all the guys in Keansburg Father Time and New Jersey, we thank you, and we thank you for this award.
Thank you, Kathy. Also, she forgot to mention, but ABC World News Tonight, Cynthia McFadden came to Keansburg after contacting us and interviewed Bob and other parents, and there was a segment about the month it was that aired on ABC News about Parents Anonymous and these dads in their group, which was wonderful. If you want to see that, you can go onto the Parents Anonymous website to see that segment of ABC News. Secondly, because of our belief in shared leadership, Tanya, would you step up on behalf of Tim Phillips? And their pictures are in your books. I thought their pictures would be up there. Oh, great. Thank you. Thank you. I can't see over there very well. Tim was nominated by Parents Anonymous of Oregon, and all these awardees are selected by the National Parent Leadership Team of Parents Anonymous for his exemplary commitment and dedication to achieving meaningful shared leadership to strengthen families nationwide. So Tanya is accepting on behalf of Tim.
Thank you very much. And since I have not had the honor of meeting Tim, who is from Oregon, he did send us his speech, and I'd like to read it to you now. Tim says, "Hello, everyone, and thank you. It is an incredible honor to be an inspiration to receive the 2014 Parents Anonymous Juanita Chavez National Award. It could only be better if I was there with all of you today, deep in conversation about Parents Anonymous and the amazing communities of parents that we are fortunate enough to be a part of. I am so grateful to be in a position to witness the amazing source of strength and support that is uniquely Parents Anonymous. That was not always the case. I am a single father in recovery and have struggled with addiction in various forms for most of my life. Shortly after losing my wife of 40 years and the mother of our 2 children to a drug overdose in 2009, I decided it was time to clean up my act and step up and be a father. Only I didn't know how to be a father. There had never been a father figure or even a positive male role model in my life. For their entire lives, my children had suffered the trauma that comes from living in a household of addiction. Although I had always provided for them financially, my children were often verbally abused and emotionally neglected, despite what I like to think about myself as a parent. Eventually, child welfare removed my youngest child, my daughter, from my care and deemed me unsafe. When the drugs and alcohol were removed from the equation and my path of recovery had begun, I was no longer abusive and neglectful, but I still didn't know how to be the father that I always wanted to be. I didn't know what that meant or where to start. I began searching for someone or something to help me figure out this parenting thing. I walked into my first meeting of Parents Anonymous when I was about 6 months clean and sober, a group with about 12 moms and dads. Though the group was warm and welcoming, I was reluctant to speak at first, afraid everyone would see me for the horrible parent I believed I had become. I listened as the first parent shared about the daily challenges that she was having as a single mother with 3 small children. I listened as the other parents in the group gave her feedback in the way of support, encouragement, and most of all by reaching out through mutual support. It was what I was looking for. By the time that group was over, I knew I had come to the right place. I had found what I was looking for. I began attending the group every week and discovered that the ability to share our challenges as parents in a supportive, non-judgmental environment was perceived as an act of strength. I began to develop friendships and, for the first time in my life, a true sense of community. The shared leadership and mutual support among parents was and continues to be a solid foundation from which healthy families can be built. I know this to be true. This is my story. 4 months after walking into my first group of Parents Anonymous, I was reunited with my daughter, and 4 years later, she is 17. Our lives are far from perfect, but she enjoys more stability than she has ever known before, and I am learning to be the father I always wanted to be, the father that she has always deserved to have. I am now a Parents Anonymous parent mentor and group facilitator, in which I support other moms and dads in their recovery journey, resulting in strong families. The shared leadership model work is so rewarding. I consider it a privilege to participate in meaningful dialogue with other parents like me, which were it not for Parents Anonymous, these concerns might not have been dealt with openly and in a supportive manner. To witness the transformation of individuals as they find their voice, advocate for their families, and create change as they experience what it feels like to be a positive role model in the lives of their children, their families, and their communities has been and continues to be one of the most humbling and rewarding experiences of my life. My deepest appreciation to Parents Anonymous, parents, staff, and volunteers worldwide, and all of you who are engaged in this life-changing work. Congratulations, Tim.
Thank you so much. That was just really wonderful to hear from those voices. Now I'd like to invite Roger Sherman and Annette Jacoby to come forward, and we'll present the Ray Helfer Award from the National Alliance of Children's Trust and Prevention Funds.
Wow, good morning. Mike Foley, who's the president of the National Alliance, had surgery yesterday, so keep him in your thoughts. He seems to be doing well and getting better, but he's the one who's in your program and was expected to be up here, so please keep him in your thoughts. So each year, the National Alliance of Children's Trust and Prevention Funds and the American Academy of Pediatricians gives this award to a pediatrician who exemplifies the commitment and spirit of Dr. Ray Helfer, who is the father of the Children's Trust Fund movement. This year's awardee is Dr. Deborah Shropshire, who was just called out on a medical emergency. I was thinking, gosh, I'm going to have to do her in absentia, but fortunately she was able to deal with that quickly, and that's what doctors do, right? They serve. Deborah Shropshire is a pediatrician at the University Medical Center in Oklahoma. She's the founder of the Fostering Hope Clinic that provides services to children in foster care. She's also been involved in myriad prevention efforts around child abuse in the state of Oklahoma and works in collaboration with the CBCAP lead in that state. She's a great partner. Dr. Shropshire's commitment to the well-being of children has earned her many accolades, and on behalf of the Alliance, I am proud to present the 2014 Ray Helfer Award to Dr. Deborah Shropshire.
I am just going to tell you, if you have a medical emergency in this place and I'm the responder, you're in trouble because I'm a pediatrician. And so responding to adult emergencies is something I haven't done in a while. But the good news is, no, I didn't have to do any CPR or anything like that. We're good. We're good. I am so honored to be here, very excited to be here. Thank you to the Alliance, to Annette, to Sherry, who wrote the nomination. They made me sound like a saint, which I am by no means a saint. I get to work with some awesome people in Oklahoma through the Department of Health, through the Department of Human Services, and many other Oklahomans who really just have such a passionate heart for kids that are in difficult family situations, and it's great work that we're getting to do there. I think we're at an interesting time right now in history where research is really helping us understand the impact of family brokenness on generations of children, certainly in some of what's going to be talked about this morning with adverse childhood experiences and toxic stress and epigenetics and some of the other sciences that we're seeing right now. And I find myself wondering if the science tells us and what we see in our own experiences that brokenness has an impact on generations, then wouldn't wholeness have an impact on generations as well? And if we couldn't get our hands around one generation of kids and figure out how to turn what's broken into what's whole, wouldn't we have an impact for many, many generations to come? And that's what I spend my time and energy doing, and I know what many of you spend your energy doing as well. I was up early this morning, which is very unnatural for me, and I was thinking about you in this audience and thinking about that there might be people in this audience who are discouraged and who are tired, and sometimes maybe it feels like what you're doing isn't really making much progress. And I want you to know today that what you're doing matters, and that, in fact, I think we're at a point in time where we're really at a tipping point in child abuse prevention, where there's opportunity for the world to change dramatically over the next few years. Don't give up. Don't give up on what you're doing right now. If your governor doesn't understand this or doesn't have a clue, don't give up, okay? If your agency head doesn't know that what you're doing matters, don't give up. If your community doesn't seem to really be very responsive or even understand what the issues are, don't give up. We're at a point in time, the right point in history right now. We have the right message, and you and I, we're the right people. And this thing is going to change. I want you to understand right now, this thing is going to change. We will see the world different for the families and the children that we serve. Thank you very much.
Wow, I am so inspired by everybody. Thank you. Congratulations. That was just great. So anyway, it's the perfect segue actually to the plenary session, our keynote. Why, when we know so much do we do so little? So on stage, you'll hear from 3 experts this morning precisely about this issue. We have a lot of research and data. I remember actually my first national conference was the 14th National Conference in St. Louis, and Vince Folletti actually shared the ACEs data, and I think all of us were just blown away when we heard about it. But we're more than 10 years later now, and so what else we need to do? We're going to kick off the presentations with Melissa Merrick from CDC, who will frame the discussion. Unfortunately, Howard Spivak, who is the director of the Division of Violence Prevention, was unable to join us at the last minute, but he's going to be ably filled in with Melissa Merrick. She's a lead scientist for the Adverse Childhood Experiences Study at CDC, and her current work examines safe, stable, nurturing relationships as they relate to child maltreatment prevention. She's also the co-author of the National Intimate Partner in Sexual Violence Survey 2010 report, and she's a lead on our interagency agreement with CDC to support the ACE study, so I've really enjoyed having a chance to work with her. And then she'll be followed by Dr. Nadine Burke Harris. She's the founder and chief executive officer of the Center for Youth Wellness in San Francisco, which integrates medical, mental health, holistic social services to improve the health and well-being of children and youth, urban children and youth. And she also counsels the American Academy of Pediatrics as a member of the Medical Home for Children Exposed to Violence Committee. So she's really aware of all these issues. I think she was brought to our attention. A number of you may have read that New Yorker article, The Poverty Clinic, about her a couple years ago. So all of us, that was circulating around the Bureau, I will say, that we were reading. And then, and actually, we wanted her to come to 2012. She's, but she was pregnant at the time, so she came back 2014. We're happy that she's here. And then finally, so excited to have Larry Adelman here with us. He plays a leading role in developing socially engaged film and video, and as president and co-director of California Newsreel. He's the creator and executive producer of The Raising of America, Early Childhood and the Future of Our Nation, which is currently in production. So what I love about his unique perspective as a filmmaker is something that we all need to learn from, is how do we tell our story? How do we communicate a powerful and compelling message? So I think we'll share all those 3 perspectives in this plenary session, and we look forward to hearing from them about where we should be going. So Melissa, please join me in welcoming Melissa Merrick.
Thank you, Melissa. So happy to be here. Good morning. So why, when we know so much, do we do so little in preventing and overcoming early childhood adversity like child maltreatment? Provocative title, yes. So in the next 5 minutes or so, I'm hoping to provide a brief overview about what we do know in the science related to early adversity like child maltreatment and lifelong health and lifelong potential. Health, life potential, other outcomes. And then shift the focus a little to the critical importance of prevention. And then I think that'll set a nice stage for our other 2 speakers Nadine Burke Harris, who will share the critical importance of the medical home in promoting resilience and overcoming adversity, and certainly Larry Adelman, who will broaden our focus to really talk about the critical importance of changing the national dialogue around early childhood and the future of our nation. So I'd like to begin by just providing a brief overview of the Adverse Childhood Experiences Study. The original Adverse Childhood Experiences Study was really a collaboration between the Centers for Disease Control and Prevention and Kaiser Permanente, a large HMO out of San Diego, California. And they basically asked adults who were coming in for physical exams, routine medical visits, about experiences that they may have had or may have experienced under the age of 18. And here you can see the particular experiences that were assessed. So by no means is this the entire universe of early adversity that a child may experience, just 10 indicators of things that might be going on in the home. So indicators of abuse and neglect, and then other indicators of family challenges like household mental illness or household substance abuse. And then they compile an ACE score, which is a really simplistic basic count or sum of the various categories of experiences that the participants may have experienced under the age of 18. So again, a sum where 1 is 1 experience, 2 or 2 experiences. It doesn't get into the severity of these experiences, how long in childhood they experienced these experiences, and other dimensions that we know from, long scan longitudinal studies of child abuse and neglect data really matter in predicting outcomes. So it's a more simplistic view of just what might have happened. And maybe not surprisingly to the many of us in this room today and virtually attending this conference, the ACE score, even among this insured, mostly higher socioeconomic status, mostly white, 17,000 participants, at least half or more than half had at least 1 ACE. And in fact, if you had 1 ACE, you were 84% more likely to have subsequent indicators of adversity. It's not just that the prevalence was high, it was also that it had stark associations with a whole host of outcomes in adulthood. So there's been over 45 empirically tested associations between early adversity, ACE score, and lifelong health outcomes. So here you can see some chronic diseases like cardiovascular disease and diabetes, subsequent violence or victimization, perpetration experiences, substance use, mental and physical health outcomes. And in all of these 40+ outcomes that have been investigated, you see this same graded dose-response effect. As your ACE score increases, so too does your risk for a whole host of problems. This is not just seen on using these ACE data. In fact, many states, up to 22 states that we know of, have administered the ACE module on their behavioral risk factor surveys. They find similar prevalence, similar relationship patterns. Long scan data, similar. NCCAN, the National Survey of Child and Adolescent Wellbeing, NCCAN, the National Survey of Children's Exposure to Violence. No matter the data source, we're seeing this consistent pattern where the more adversity you experience, the more likely you are to have poor health and other outcomes. In fact, we also know from Brown and colleagues that there's a 19-year difference in life expectancy between people with low versus high ACEs. 19 years. That's a far greater life expectancy inequity than we see in most any illness, injury, or geographic comparison. And for some, it's not just that early adversity has an impact across the life course. It's that for many, early adversity starts in childhood and continues across the life course. And then this, of course, has a compounding and cumulative impact. And we also know that certain experiences, like violence and other adversity, can really compromise the way the brain develops. We know that excessive, repeated toxic stress can impair cell growth, it can interfere with the formation of healthy neural circuits, and it can really contribute to premature aging of the body. Some frightening sort of epigenetic work shows that it's not just changes in the brain architecture or brain development, but really how our biology expresses itself can also be impacted by early adversity. So I'm not a physician, I'm not going to get into the particulars of this, but basically telomeres are those little red parts at the end of the DNA strand, and we know that they're shortened with each cellular division and can contribute to aging. And there's some real provocative research now out of Terry Moffat's group and others that are really seeing that early adversity can cause advanced erosion of these telomeres, which means that children that experience early adversity are at increased risk for decreased lifespan and earlier acquisition of disease. So why are we all really here today at this conference, at this plenary session, virtually attending this conference? Really to find out what we can do. And so certainly CDC, our role is sort of this public health model of violence prevention where we're really interested in stopping violence before it occurs and really stemming the flow of children entering the child welfare and other juvenile justice systems and reducing violent injuries and deaths. But from this slide, you can see that we all have a role to play. It's not an either or, it's a both and this is all of our missions to really prevent violence and promote health and well-being for all our children and families. The way CDC envisions this is our vision for childhood, is assuring safe, stable, nurturing relationships and environments for all children. Historically, we've really done a lot of work on the relationship component of this, but we're increasingly interested and realize that relationships really develop within a context and an environmental, socio-political, community context. And so we need our work to continue to increase in focus on health inequities and the promotion of health for everyone's children, not just my children. My children will do better if everyone's children are doing better. And so this is just a simple graphic to show that individuals are really nested within relationships and communities and societies in which they reside. So it's really critical that prevention strategies include a continuum of activities that address multiple levels of influence. And this is not done alone. This is with partnerships, not just our usual suspect partnerships, non-traditional partnerships too. We really need to engage key stakeholders at every level of the social ecology to really make the greatest impact for our children and for our nation. And so CDC is currently funding 5 state public health departments to implement Essentials for Childhood. Essentials really creates a framework for how to use child maltreatment, how to address child maltreatment rather, by raising awareness and commitment to the issues and to the science that we've reviewed today, to use data to inform prevention and other action, and really to create the context that will support safe, stable, nurturing relationships and environments through norms change and programs and policies. So I hope that's whet your appetite a little bit for what's to come, and we'll be really interested in the conversation that this sparks afterwards. Thank you.
Good morning. My name is Dr. Nadine Burke Harris. I am a pediatrician, and I am the founder and CEO of the Center for Youth Wellness in San Francisco. I'd like to start off by just congratulating the awardees for the amazing work that they are doing on the ground in the community. And I would like to thank the Children's Bureau for inviting me to come and speak here today. I don't have any PowerPoints, and that's for a very specific reason. Because we had an excellent presentation of the data by Melissa. You all can go and look up the data, on the World Wide Web. This is a movement. And I am here to enlist you in this movement to change the standard of practice for our children. And when we think about the prevention of early adversity and the prevention of child maltreatment, oftentimes we think about mental health centers, the criminal justice system, social services for parents, etc. But I really want to strongly encourage you to also think about the primary care home as a central place where this work needs to happen, because there we have an opportunity for prevention. I'll share with you a little bit about my story. I did my pediatrics residency at Stanford, and when I finished, I was deeply committed to addressing health disparities, and so I came to work at California Pacific Medical Center in San Francisco, and my job was addressing health disparities among our most vulnerable community. And so I looked at the data, found the area in the city with the highest rate of health disparities, which was a neighborhood called Bayview Hunters Point, and together with the hospital, we opened a clinic in this neighborhood because we know access to care is one of the first steps that you need to take in addressing health disparities. And I was totally naive. I had no idea what I was getting into. But when we went and set up standard protocols for addressing asthma and immunization rates and nutritional education to address childhood obesity, the weirdest thing in the world happened. We were actually reasonably effective. But as I was sitting in clinic and seeing patient after patient after patient after patient and hearing their stories, it turned out what happened was all these teachers and ministers and principals and school nurses were sending me kids and saying, Dr. Burke, could you please see Jimmy? Jimmy's got ADHD. Can you please prescribe him some medication? But when I did my job, and I actually did a thorough history and physical, I couldn't make a diagnosis of ADHD or attention hyperactivity disorder. Attention deficit hyperactivity disorder. Because most of the kids that I was seeing in clinic had such a terrible history of trauma that I simply was unable to make the diagnosis. I'm talking about kids, thank you. And you know who these kids are because you are also taking care of these kids every day. And so I started piecing together some of these stories, like the young girl that I was seeing with a terrible asthma exacerbation, and her mom said to me, I said, what are her asthma triggers? Is it pet hair? Is it dust? Is it, pollen? And the mom said, you know what? I notice her asthma tends to be a lot worse after her dad punches a hole in the wall. And then I saw another child in clinic who had a terrible scalp infection. As I'm leaning over him, he gets really scared and bam, he kicks me. And I'm looking at that and I'm saying, my God, his stress response is way overactivated. Now, this is the way medicine works. If I saw patient after patient after patient who drank at the same well and they all developed diarrhea, I could prescribe dose after dose after dose after dose after dose of antibiotic, or I could go to that well and say, what the hell is in here? And so that's what I did. And I started looking into the research about how exposure to trauma affects the developing brains and bodies of our kids. And when the psychologist that I work with presented me with the Adverse Childhood Experiences study and says, have you seen this? It fully blew my mind, right? First, because of what you heard from Melissa, that it was so common. 67% of their population had at least one adverse childhood experience. And I'm not talking about my kids in Bayview. We're talking about 70% Caucasian, 70% college-educated population, right? 12.6% of their population had 4 or more adverse childhood experiences. And if you had 4 or more adverse childhood experiences, your relative risk of chronic obstructive pulmonary disease was 260%, of hepatitis, 250%, of depression, 460%, of suicidality, 1,220%. 12 times the risk of ever attempting suicide if you have an adverse childhood experiences score of 4 or more. If you had an adverse childhood experiences score of 7 or more, your relative risk of ischemic heart disease, the #1 killer in the United States of America, was 360%. Now, as a doctor, I took this information and I say, damn, I better start screening for this. And that's immediately what we did. We just developed a form and did a checklist and started asking. Because I know that if that checklist tells me, if that score comes back, and that child has 4 or more ACEs, I already know their relative risk of chronic obstructive pulmonary disease. I already know how likely they are to engage in high-risk behavior, to have teen pregnancy, to have early paternity, to be depressed, and to ever attempt suicide. I know that by a screening tool that I do in clinic. Now, so, you know, looking at this data, not only did we change our practices, right, because it starts at home, went out and started shouting from the rooftops, because I'm like, oh my God, this is a massive public health threat. And of course, immediately, policies changed, funding opened up. Oh wait, no, that didn't happen. People said, Dr. Burke, how can you, we can't ask these questions. It's too invasive. Let me tell you something. I remember in med school when I learned how to do a prostate exam. That is invasive. If we can train young physicians to do that, we can train young physicians how to screen for ACEs in the primary care setting. So then the next step is, okay, well, if we do that, well, what do we do? Now, in our clinic, because of the needs of the community, when I started the clinic and I went around and said, what do you need, what do you need? Going to churches and after-school programs and all of it, I said, what do you need? And folks said to me, you know, there is so much violence in this community. We need mental health services. So I said, okay. So we had, in our teeny, tiny little clinic, we had a psychologist and we had a case manager. And because the psychologist got tired of me walking into his office and crying with a horrible story that I just heard in the exam room, we actually instituted something called multidisciplinary rounds, where once a week we would sit down. I would present my most challenging cases to our care team, and we would work out a disposition. So the psychologist would take care of the mental health piece, the case manager would do a home visit or reach out to the school or get an educational care plan and all those things. And I thought that I was doing something amazing, right? I've gone to so many conferences and talked about our novel way of addressing this with our multidisciplinary rounds. And it turns out it's actually integrated behavioral health services, right? Who knew? I thought I was doing something special. So we start with universal screening. We support integrated behavioral health services. And the third piece is that we really need to look at investing in effective interventions. Now, the reason I say that we got to look at this totally differently is because when we think about exposure to early adversity, we think about it as a social problem, and we think about it as a mental health problem. I am here to encourage all of you to change your thinking. We need to approach this as a medical problem. And the reason for that is when you're approaching a public health threat from a medical perspective, you use a whole different set of tools. When we looked at HIV/AIDS in 1983, the time between diagnosis and death of HIV/AIDS was 6 months. Half of the people died within 6 months of diagnosis. Today, on standard antiretroviral therapy, the mean survival is greater than 50 years. How did we get there, right? Number one, it started with a public education campaign. And that is what we need to do for ACEs and toxic stress. You gotta get out there, we gotta get out there, and we have to shout it from the rooftops. We have to let every single person know about the transmission of intergenerational and intercommunity violence. The second piece, and the fact that it's a medical issue, the fact that it affects the development of our children's brains and bodies. I think we kind of are getting an awareness now that it affects brain development, But the reality is, the reason that ACEs are a major risk factor for ischemic heart disease, the #1 killer in the United States, the reason if you have 6 or more ACEs, your relative risk of lung cancer is threefold, and the reason if you have 2 or more ACEs, your relative risk of autoimmune disease is twice, is not only because of increased high-risk behavior, right? When they do the logistic regression analysis, high-risk behavior only accounts for 50% of the increased risk. It's because when you are faced with that stressful or traumatic situation, especially if you are a child, that fight or flight response that gets activated, that surge of adrenaline and that activation of cortisol, not only affects your brain development, your neurons, your receptors, it also affects your immune system. Chronic adversity is a disease of chronic inflammation. I just want that to sink in for a second. Right? And that is why it is such a major driver for these chronic diseases, which are the biggest driver of healthcare costs in the United States. So when we look at chronic adversity as a healthcare issue, and we look at the opportunity for savings not only in education, not only in prevention of incarceration, not only in social services, but also in terms of that massive hole in our GDP that goes to healthcare costs, right? Then we can all be motivated to act together to do true prevention. I'm enlisting you all to join me in this movement. I challenge you to use your networks, your influence. Shout it to your neighbor across the fence, right? And that is why it's amazing that we have folks like Larry Adelman doing the work that he's doing to use media to lift up this issue. The public education campaign is critical. We need to advocate for early detection. I advocate for universal screening, but we also need to advocate for data gathering, because we can't assess how big of a problem it is. We can't assess a response until we know how big the problem is. And finally, invest in effective interventions. With HIV/AIDS, it was really important that we said people have to use condoms and people have to do needle exchange. But highly active antiretroviral therapy is the thing that was the game changer. We need to invest in basic science research, clinical research, translational research, and we need to invest in the training and education of the next generation of clinicians. Every single one of us is part of the solution, and my charge to you is to join me in this movement. Thank you.
Hard to follow, but inspiring. And it's work like that that inspires the work that we do as filmmakers, because frankly, as I was telling Dr. Burke before, all we do is steal. We steal from the work of her and Dr. Merrick, in fact, many of you out here. And we're going to start, before I say anything, I think, with a brief 6 minutes of sampler, 5 or 6 minutes sampler From the film, The Raising of America, which in fact is a 6-part documentary series, a companion website, the public engagement campaign, of which we'll be talking more about how you can actually use that to help build that public education campaign and engage various sectors of the public in this movement, in a section that my colleague Rochelle Poulin over there, I think, will lead after this session in Strand 10, I think. And I think we're very, very honored that Dr. Renee Boynton-Jarrett, who you'll see in this clip, is also going to join us. So why don't we, if we're ready, run that clip, and then I'll jump back up here and make a few comments. Thank you. Is that right? We can do that? Maybe we can start that again with the audio. No.
In the richest nation in the world, our children's well-being, measured across multiple dimensions, ranks 26th out of 29 rich nations. Why that is and what we can do about it matters. To this child, to all of our children, and to the future of our society.
We talk a good game in this country about being family friendly, but in providing for the economic and social needs of families, we are woefully behind other countries.
Want to show Daddy a book?
In today's day, we all gotta work. And I can remember back in like my grandfather's days, the man work, the woman stay home and take care of the house and, family, thing like that. In today's day, it surely can't happen. Everybody gotta go out and work and, bring it in.
Very good. Yeah, you're going to show Daddy
Yeah,
a book?
he works a split
Very
shift.
good.
So like 2 in the afternoon to 1, 2 in the morning. I'm on nights this week. And so the next week though, I'll be on days.
Americans now work more hours than every other rich nation, yet the middle class is shrinking. Social mobility is less than it was 50 years ago. And most damning, 1 in 4 of our children is born into poverty.
David, tomorrow's a really hectic day. I have a training. I have to be there at 9 o'clock.
70% of our children are growing up in families headed by working parents.
I bring work home with me, and it's not required. It's just what I do so that I don't feel as overwhelmed.
Things just barely work out. Like feeling security. I don't really know what that feels like, to feel like, all right, we're good.
That way, no, you silly girl.
I wake up in the morning and I'm on.
It's like, where's my other child?
And then I go to work and I'm on.
You have a good day, little one.
And then I come home and then I'm on until the kids go to sleep.
There's 4 different places that everyone needs to be in.
It's too much. I can't do it.
Our policies actually actively discourage parents from being able to take care of those kids well in their prenatal months, in their early years, and getting them ready for school.
Among the world's richest nations, the United States is the only country that fails to provide guaranteed paid maternal leave on the birth of a child.
It took 9 years to get unpaid leave. That's disgusting.
40% of all American mothers are working within 3 months of their baby's birth. Some because they want to, most because they have to.
Our child care expenses, now that we have a second child, it's way more than we spend on our mortgage.
Among rich nations, our child care ranks 16th in affordability, 22nd in quality.
I picked him up one day and I went to change him and his bum was bleeding. So we left there right at that point.
We rank 31st in availability of child care.
So this is our wait list, and this is the wait list just for infants and toddlers.
If I'm not there, I'm entrusting someone else to keep her safe, to teach her, to help her grow in all areas, developmentally, spiritually, because we can't do it alone, you know.
Once you imagine that every family stands on its own, you're really making it impossible to create a national vision of everyone doing well together.
A lot of us buy into this idea that a parent is the one responsible for their child's development and their outcomes.
Go ahead, Lily. What are you thankful for?
My mommy and my daddy.
But let's just step back for a moment and just look at what exactly the reality is for a child. So you have a child who's an individual with their biology and their genetics and their personality characteristics. And they're nested in their family, their peers, their close social relationships. But that is nested within another level, which is your school, your community institutions, your neighborhood. And that level is nested within our culture, our laws, our policies, our social structures, our systems. As a society, where do we see the role of our policies? Isn't part of that role to help children to grow and develop?
Thank you. So that's just a sort of sample clips from what will be a 6-part series, which will be released this fall. In other words, what you can see is what we're trying to do here is just simply translate some of the science that you all know into a new story, one that links a strong start, not just to better individual outcomes, or better learning, earning, and mental and physical health, but indeed to a healthier, safer, better educated, more prosperous, and indeed more equitable nation. But there's a rub, you see, because the causative arrow goes both ways. Isn't it true that strong communities and a more equitable nation are critical to producing those safe, stable, and nurturing relationships that Dr. Merrick mentioned before, that essentials for childhood? Those environments where all of our children have the opportunity to thrive. Might, in fact, family wage jobs and economic security for parents and caregivers help? Or quality, affordable housing, a safe neighborhood where people share a sense of inclusion and indeed hope, access to high quality early care and education, where parents aren't living in fear of deportation. And what about paid parental and sick leave? Not to speak of mental and physical health services and basic primary care. Might those just help a little bit in what we're talking about? So as I said, we're going to have a discussion about how to use this film and the companion tools after this. And we'll also be showing clips from one of the episodes called Wounded Places, Confronting Childhood PTSD in America's Shell-Shocked Cities, which is perhaps most germane, I suspect, to the work that you're doing here. And even if you can't come, please come to our temporary website at raisingofamerica.org and learn more and join us and become one of our partners where you can show the series to help build alliances within and across sectors with your constituencies. Indeed, just get your staff on board. Okay, so what we've heard here so far is about the importance of early life and experiences, and we get to the question, of course, of why is it that when we know so much, why have we done so little? Why have we made so little progress? But most of all, more importantly, let's shift that frame to how we can do better. You know, it's interesting, I thought, that one of the first reports by Sir Michael Marmot's Commission on the Social Determinants of Health pointed out one of the reasons for this. And that's that what might be at least as crucial as the evidence is the stories in which they're embedded. And then out of that, in fact, inspired our earlier series, Unnatural Causes, Is Inequality Making Us Sick? And this series grew out of that one. And so today what I'm going to do, I think, is describe briefly, in the time that I have, a little bit about how we as filmmakers approach this challenge of translating the evidence into forms that are both popular and compelling, but most of all, one capable of engaging parents and practitioners and policymakers and the general public, engaging for them to consider society's interest and role, not just their own, but the role of all of us in the early years and in giving every kid an opportunity for a strong start in life. And this begins, I think, with the idea of, for us, what this means is our starting point was not so much what's on the screen, but in fact what sits before it, that is the audience, or more precisely, what are the assumptions, the default understandings, the habits of thinking, as it were, which often are unarticulated, yet deeply imprinted, and are used which people carry in their heads and use to carve up that evidence and give it meaning and use it as a lens to interpret it in accord to, interpret what they see and hear in accordance to their own worldview. And the power of these discourses, interestingly, that surround us is that they appear natural, they're self-evident, and they become internalized in an unquestioned common sense. You never question it. This is sort of the world in which we live. And so as a result, they sort of limit our critical thinking and they constrain possibility. So if we're to engage the public imagination for the bold and transformational changes alluded here, the changes that are needed to give all our children a strong start in an equal opportunity childhood, we realize that what we as filmmakers need to do we begin to problematize, even rupture some of these conventional assumptions, to open up that space for that new dialogue so that we can build that new movement, because otherwise we're really constrained in the old way of thinking. But a quick critical question is whose voices get heard and which stories get told. In changing that dominant narrative produced and reproduced by corporate media and other gatekeepers is not so easy, as even Upton Sinclair pointed out 80 years ago. And if you'll excuse me for 1 minute, I'll get my water. Because my mouth is growing dry. And it's hard enough for me to speak even when it's wet. Thank you. Now, if I can do this without having it fall all over me. So we began then this project actually by conducting a needs assessment with the help of Frameworks Institute to help us identify some of the core elements of the conventional story, that is, those normatized understandings which stand in the way of so much change. And for us, our challenge is how we could build a new story that could in a way widen that lens. So first I'm going to some of the elements of the core story, the old story on the left, and then we'll go through the new story, the emerging story on the right, and we'll see how much time we have. We got 2 of these to do, but there's a lot of this stuff. The first you're most familiar with, which is that, as Jack Shankov says in our film, babies don't remember. And as a result, babies are seen as naturally resilient. It doesn't make a difference what happens to them. They'll grow out of it. You all know that's wrong. But what happens during infancy, most people feel, and during infancy in the early years, is not really as important as what happens in school. And that's one fallacy we need to put behind us. As Grady and Auburn argued about a decade ago in a brilliant paper, that the conventional belief that the success or failure of kids can be traced to whether they had good or bad parents who made the right or wrong choices. The good mommy, if you will. And it sticks. And it sticks probably more than anything else. And it sticks in part because there's some truth to that. I mean, as a parent, I know all the mistakes I made. I can tell you, and my daughter can tell you even more so. But this right choices dialogue or frame really blinds us to how a growing number of parents and caregivers are hindered by economic uncertainty, are hindered by the social isolation and the growing squeeze on their time, on their money, and on their resources. And if these conditions are chronic, we now know, science shows us, that they can be toxic for children. And this is what we could, the social scientists, I guess, call an attributionist model of success or failure, and it flows from the notion of the self-determining individual. But all you need to get ahead, right, is some self-discipline, some intelligence, some hard work, some grit, maybe a little luck, right? It's all about you. And of course, if kids fail, it leads us to blame parents for those failures. So one of the ways in which it most clearly plays out is in looking at poverty, as we see in the media all the time, because this attributionist model is widely posed as a way or poverty is often posed as a way as a kind of a deficit or a lack of money and jobs, of course, but also of skills, of fathers, of role models, of behaviors, and of course of proper character and morality. This is where the focus in the media is. What's wrong with those people? How many times have we seen that over and over again? And conversely, those who succeed do so on their own, right? By dint of their own grit, their determination, their character, their self-discipline, their hard work. So there's little recognition then in the media of how the dice are stacked against the poor. No transportation, lack of reliable jobs, social exclusion, problems of food security, food insecurity, child care, the difficulties of putting an orderly life in place, and of course the stress, anxiety, even fear, which too often becomes one's lifetime dance partner in that situation. Now this attributionist model, let's be clear, feeds on racism. I think we've seen that most recently, in the last few days again, because racialized beliefs are one way in which a nation which professes a profound belief in equality rationalizes inequality. It's not inequality that's the problem. Oh no, it's not the structures or institutions which might disproportionately channel power, status, and wealth to folks who might look like me, the unmarked race, right? No, instead there's something wrong about those people, particularly the poor and poor people of color. And when the Clippers owner, Don Sterling, was sued by HUD for his rundown apartment complexes, what was his response? Did he take any responsibility for the problems with those buildings? No, of course not. It was the fault of those damn Mexicans and African Americans who live there. Again, the attributionist model. Okay, so how in this case are we attempting to widen the lens a bit? Well, first, the easy one for you here, as Jack says in our show, we may not consciously remember, but our brain will remember. The body remembers, as both Drs. Merrick and Dr. Burke have said. It becomes imprinted in our biology. As you know, science tells us that experiences in the womb in the earliest years really do wire the developing brain and other bioregulatory systems for better or for worse, and in doing so, build that foundation for lifelong, not just cognitive, but socio-emotional and even physical health trajectories. But I want to raise a question here for all of us, because it's critical. Because in focusing on the early years, how is it that we also how do we avoid a new determinism, that life is over by the age of 5? Because we all know that our brains remain plastic, that developmental trajectories can be influenced during many critical periods during our lives, even for those whose trajectory seem limited. Now, next one here is Jeannie Brooks Gunn told us that we have huge inequalities, she said, but few seem to care. Instead, we blame the parents. But parents are enmeshed in a web of relations that constrain or enhance what they can provide. So our challenge as filmmakers then, and I think to all of us as communicators, is to try to sort of render, if you will, how social circumstances can help or hinder developmental trajectories. Some children face a pileup of risk, others an accumulation of advantage. As Thomas Piketty illustrates in his new book, Capital in the 21st Century, the growing redistribution of wealth upwards comes at the expense of most parents and caregivers who find themselves increasingly, as I said, squeezed for time, most of all for money and for resources that are drained out of their communities. And those stressors, science now shows us, now illustrates, can drip down on children, on their children, with long-term consequences for developmental outcomes. But the problem here is that there's really two different worldviews at stake. Do we see ourselves in a world of self-makingness, of the self-determining individual, or one of social connectedness? A world where every kid can succeed if only they learn grit and self-discipline? Or a world where helping children means indeed improving opportunities and conditions faced by their parents and their caregivers in the communities in which they live? So what's interesting here is last year that 1 in 4 children, as was pointed out, were born into poverty. Almost 70% of those are children of color. Of 35 countries surveyed, only one has a higher child poverty rate than the United States, Romania. We did beat Romania in the child poverty Olympics. So instead, when talking about early child development, what if we widened our lens a bit, widened our attention from the attributes of the poor to those institutions or corporations or those other folks, people who profit from, or dare I say, exploit the poor. Or as Thomas Edsel more bluntly put it in a New York Times column about a year or so ago, rob them. You know, yet exploitation, like its running mate racism, is rarely mentioned in polite company, and I'm glad we're not so polite here. It is virtually absent from our national discourse of poverty, on inequality in general, and certainly that of early child development. Yet exploitation and racism rob communities at every turn, as we know, anywhere from landlords to food prices to redlining and this flip side predatory lending, the privatization of prisons. I can go on. You know, 1 in 4 jobs in America today, not 1 in 4 new jobs, but 1 in 4 jobs, period, pay less than poverty wages for a family of 4. And that, of course, includes those who take care of our kids, child care workers. Yet poverty is also part of a continuum. The middle class is also exploited. Their jobs are being outsourced and de-skilled. Their plants shut down, pensions stolen, benefits reduced, and most of all, their time is squeezed. Median male wages today are less than they were 40 years ago. And Americans today work more hours than any other rich country in the world, including the Japanese. And their children are suffering the consequences too. So the squeezed middle class we try to show in our show do indeed have common interests with the poor. And then finally, I just wanted to talk about racism. That is important, especially important, I think, for all of us, white people in particular, to render visible how racialization operates, how the operations of some populations, such as us, how those opportunity structures that we take for granted often burden, however, are absent from others, and often burden opportunities, families and communities of color with an extra set of adversities, from exposure to toxicants, to jobs, to housing, and perhaps most of all, to hope. All of which are a direct result of a long history and structure and practices of racialization. And this is racialization of the structural kind, not the one that gets most attention in this country, the words or interpersonal racism. So I'm just going to, given the time, I'm not going to go through these, but I just want to make it clear that the other things that we're trying to look at is how trying to break out of the idea that development takes place within a family bubble, that instead families are nested within a broader set of social ecologies, that there's a certain set of connectedness between children and families, neighborhoods, services, providers, public policy, and our economic and social arrangements. That rather than here looking at the idea of bad kids, as was discussed before, why not do we change that dialogue to injured kids or indeed wounded kids? Wouldn't that make a difference? 1,200 kids age 6 or under were suspended from kindergarten or preschool in 2012 in Connecticut alone. It wouldn't surprise you that most of those kids were black or brown. Are those bad kids or those kids that had something happen to them? So this is something where, again, you know that changing that dialogue from what's wrong with you to what happened to you, as people who are working in traumatic stress say all the time, is incredibly important. We need to take a life course approach, not just prenatal care. We can't just expect that 9 months of even the best prenatal care is going to overcome 20 or 25 or 30 years of adversity. And that, most of all, let's change this discussion from their kids to our kids. You know, we all want what's best for our kids, but how do we build that notion of social connectedness, that our faiths are connected, and that, in fact, it's not just about our children, it's about our nation's future. These are our future neighbors, our future leaders, our future teachers. These kids are our future, and it's the nation's future. So that, and finally, I want to make it clear that many people think that there's very little that can be done, but one thing that was applied here before, and I think we really need to focus on, is how all policies, not just child development policies, but all policies are ipso facto child development policies, be it housing, be it transit, be it job policy, all of the stuff that we do. And this is a way in which we can all build alliances with other sectors who don't see themselves doing which are, in fact, ipso facto child development policies. So, in fact, one of the ways in which we can bring together our groups and have more power is by building those intersectoral alliances. We hope that our series will help be able to do that in the launch events that Rochelle will talk about, so that we can make clear that that's really the challenge for all of us, and that all the work we can do in every area can help our children, and in doing so, strengthen our nation's prosperity and our equity. And so I want to make sure, just simply I'll end on this, is that basically ensuring that every child has a strong start is arguably the most prudent investment any nation can make. To do otherwise, many have argued, is an act of national stupidity, if not one of national suicide. So I'll leave it there.
Thank you so much. I know that it's given us a lot to really think about, and really, really appreciate the great, thought-provoking sessions and inspiration from this whole session. What I'd like to do for the virtual participants and for folks that want to join us in the Twitter town hall, we will be doing that for the next several minutes. There's definitely going to be follow-up sessions, as Larry said, about the Raising of America. There's a health equity session, and Dr. Burke is going to be here for a little while, I think, in the ballroom as we're doing Twitter, but if you want to wait after we finish, I'm sure she'll be around to talk with other folks. So have a good day. There's other sessions going on, I know, and thank you for your attention. Okay.